We are very likely live. Hello, everybody. Thanks for joining us for another Holistic Vet Sisters. So we're back. We're back after our mini Christmas and New Year break. And we're here again today with one of the other sisters, Vicky. So Vicky's here with us, a herbal vet that you've met on one of our previous episodes, and myself, Caroline, canine nutrition consultant, and Tina, a vet over in Norway, and Dr. Lise Hansen, who is over in, oh, you're not in Norway, you're Denmark, aren't you? Yeah, I nearly said Norway again. So we are here to answer your questions. Now, we do have lots of questions already because we're quite popular now all of a sudden, which is a good thing. And we really like to help you. And that's what we're here for, to build a community of holistic vet voices, especially the feminine ones. So we can all join together as sisters to support you. So you're welcome to ask questions as you watch this video. We may or may not get to them in this particular episode, but we will be here every Thursday at 6 p.m. UK time. So yeah, you can head on back. So we have a question. I think, Tina, you were going to start with the follow-up from a previous episode.
Yeah, so I thought we'd just start off with some follow-up from what we've been talking about previously. Because Cheryl asked if doing an ovary-sparing spay and to leave the hormones intact, does the bitch still go through a heat cycle but without the bleeding? Do they still have the mood swings? Would they perhaps still struggle being around other entire female dogs if that has been an issue before neutering? And I guess the male flip side is, would a male that had a vasectomy still be keen on bitches in heat as their hormones are intact, but just not to be fertile? So I guess we'll start with the bitch. Lisa, do you have a starter?
Sure. I mean, the short answer is absolutely yes. It's the difference between, when we talk about neutering, we have to be specific about what we mean, because when we neuter surgically in the traditional way, we take away the sex hormones and we take away their fertility. And when you do an OSS, an ovary-sparing spay, or a vasectomy, you sort of neuter, but you neuter by making them infertile, but they still have their full sexual hormones, so they still have all the sexual behavior. So a female will still come into heat. It may be less pronounced. There'll certainly be less bleeding, and she will probably be less attractive, or she may attract males to a lesser degree, but if she's living with a male or gets into close proximity with a male, she'll certainly still be on heat, and he will probably notice it, and they may well mate. Which is, and all the reasons that we used to have, or thought that we had, for neutering in terms of regulating behavior, making males less likely to stray looking for females, making females less likely maybe to fight with other females, or less likely to mate, certainly, less likely to go into false pregnancies. All of that hormonally controlled behavior will continue. And this is exactly why I think the ovary-sparing spay has limited relevance, because you still get all the hormonal behavior, so why not just leave her intact? But there are some situations maybe where it's an appropriate thing to do, but we can't just liken it to a traditional spay, because it doesn't have the same effects at all. So the very short answer is yes. It's they will still be hormonally intact, and they will still behave as if they are intact. They will still think that they are completely intact.
Yeah, and they may still have some small amounts of small discharge when they are in heat.
Yeah.
And then to the male part, yeah, I was asking if the male, if a vasectomized male is still keen on bitches. So Vicky, do you want to answer this one? Or
you're muted.
Can you hear me now?
Yeah.
Yes. Yes.
Like Lee said, it's basically the same for the males. You are not removing their testicles. You're not removing any of their hormones. You are just stopping them from being fertile. So all of their behavior, if they've had a certain set of behaviors, chances are it's going to be exactly the same if they've had a vasectomy. They're just not going to be able to actually impregnate a female if just working around a child's head. If they mate, which they will still do if they're given the opportunity, they just won't impregnate her.
And we know this from men, of course. I mean, the vasectomy is quite a common procedure in humans, and it just makes you infertile. It doesn't affect you in any other way. So it will be exactly the same for male dogs. And because we should maybe add that because there is a risk of fighting between males and females if they try to mate, or if they're tied, there's a risk of intact males fighting, especially if there's females on heat around. So it's not the case that you can just do vasectomies and then let them get on with it. You know, I would certainly not consider that safe. So they become infertile, but that's the only thing that happens. As far as their behavior is concerned, for both sexes, they still think that they're completely intact and they would still mate.
And I think what's really important for people to remember if they've got a male and a female dog is that that isn't necessarily the solution. You can't just do a vasectomy and an ovary sparing spay and then just leave your animals to run rampant together, because
exactly.
So you would still have to isolate your female, yeah.
Exactly.
And I think Caroline had another question that you wanted to read out.
Yes, we do. We have a question from Jen about her border collie, Will. He has been diagnosed with a Sertoli cell tumour, which is actually benign. Now, Jen's using some homeopathy here, actually, Lise. She's using conium 6C, but she would prefer to save his testicles, save the testicles, but obviously the vet is suggesting castration. So anything Jen can do or anything Jen should know?
Do you know how old he is, or if he has any other conditions? Meaning,
I do. I can look that up. I think he was about 5. Let me just double check though. I don't think there's any other conditions. He's 5. He's raw fed, never had conventional medical treatment, has not had any vaccines. He has chiro treatment. He's not really had anything happen to him, really, apart from behavior changes, which is how she knows me.
I mean, I'm all for non-invasive treatments whenever possible. I'm a homeopath, but if you come to me with a dog with a Sertoli cell tumor, I would castrate him. I don't know, Sertoli cell tumors are not always benign, and they can metastasize, they can be cancerous, and they can have systemic effects. So they can make him ill. I mean, they can cause bone marrow suppression. So all sorts of things can happen. The prognosis is good if you castrate and it hasn't spread at the time when you castrate. But to me, it's a little bit hazardous to let a dog walk around with a testicular tumor. I mean, if it was a person with a testicular tumor, I would want it removed. I would treat homeopathically, partly to support him around surgery, and also to address the imbalance that I would feel has to be present in him to make this tumor in the first place. But I would remove the tumor. If it's a one-sided thing, you could even argue that they don't have to castrate him. They could remove the affected testicle, and then they could leave the other one, so he would still be hormonally intact. But I find it difficult to argue for leaving a tumor in place. If he was 14 and had heart disease or something, then you could maybe say, sure, it's unlikely to be what kills him, and we don't want to put him through surgery, and so let's leave him like that. But if he's young and healthy and he has a Sertoli cell tumor in one testicle, I would remove it. It doesn't even necessarily mean castration.
Absolutely. What about you, Vicky?
I mean, I completely agree. It was always one of the things that I would say to people that would always ask, you know, pre all of the changes in the neutering law, when someone would say, you know, should I castrate my dog? And I would be saying, no, not unless you've got a reason to. And one of the things I would say is that, you know, in an entire male, the only thing you're really worried about in an older dog is that they might get a testicular tumor. But the great thing about a testicular tumor is that you can just remove it. And then you've resolved the whole tumor problem. It's not like a bone tumor or a splenic tumor or any of these other like horrible tumors that are much more complicated. Like every vet has done a bazillion castrations. It's a really straightforward operation. It's done like a normal castration. You just remove the testicle and you remove the problem. And if it is just one side, you can just remove that one testicle. And like Lise, I just feel anxious about leaving something like that there where you don't know the impact that the changes in hormone levels and everything else is going to have on the animal. And it's so easy to just remove it. And if the dog's only 5, it's not like Lise says, it's a really old dog with other things going on where you might just monitor it. It's a young, healthy dog. There's no reason, unless she's got a specific one, for keeping the testicles.
Yeah. Brilliant. Okay, we've covered that.
Good question.
So take more questions.
Yeah, so we had one question here about rabies vaccines, because maybe not everyone's aware of this, that most rabies vaccines in conventional practices contain thimerosal, which contains mercury. And the thing with mercury is the biggest issue that has been identified is of concentration, which is why they actually have discontinued these vaccines in humans, in children. So the question was, what rabies vaccine is the best for least side effects? Because obviously in some states in the US and stuff, you have to do rabies vaccines. And yeah, obviously as mentioned here, a thimerosal free vaccine, obviously without mercury, is would be a better option. You probably have to ask your vet in advance, because I think most practices don't keep these. And then there was also a question regarding inactivated versus modified live vaccine in the rabies vaccine. I remembered Lisa wrote a lot about this in your book as well, if you want to discuss.
I don't think there is a live rabies vaccine.
Modified. There's a modified, I think.
Is there? I thought the only rabies vaccines I know are killed vaccines.
I thought that too.
I think I had someone, Melissa, wrote as well and asked just simply, do dogs need rabies vaccines? And I think maybe if we start there, most dogs don't. You know, if you live in Europe and your dog doesn't travel across international borders, no, it doesn't need a rabies vaccine. So some breeders sort of seem to think that it's the deluxe package if they include rabies in the puppy vaccines even, and I certainly find that quite often, or that dogs have had rabies just because it's available, so why not, just in case? And I would highly discourage that. I think the fewer rabies vaccines you can get away with giving your dog, the better for their health. And for many dogs, thankfully, that means no rabies vaccines at all. And I do actually encourage people, if possible, in their lifestyle, to just not take their dog with them if they can. You know, the dog will be better off very often being left at home rather than coming with you on holiday, if for no other reason than because you can spare them having to have rabies vaccines. So that's the first thing I would say about rabies vaccines: avoid it if you can. And the main thing in order to avoid rabies vaccines, if you're a European, is don't take your dog from one country to another. And some people may have lifestyles that mean that they have to, or they feel that they have to, or they want to. And then comes the questions of, you know, how can we give as few vaccines as possible, and which ones do we prefer giving? But to try to avoid it full stop would be my general advice. I know it becomes more complicated in the States because in some places you have to vaccinate against rabies.
Yeah. So the modified live.
I follow exactly the same thing as Lisa. I always say to my clients, it would be better to just leave your pet at home. If you want to go to France for 2 weeks or Spain for 2 weeks, it's just not worth the potential adverse events that you could have following a rabies vaccine. And I've seen lots of them, either like aggravation of disease or trigger of different like skin conditions or immune mediated problems, or even behavioral changes. More commonly I see with rabies vaccine than with any of the other vaccines.
Yeah.
It's
Yeah.
not worth the potential risk of having that, unless you're going to be, you know, going to Europe for 3 months every year, or you're going to go traveling with your dog for 8 months, or do you know what I mean, like a really significant amount of time, like a lifestyle choice, then
Yeah.
totally worth it. But if you just want to go on a jolly holiday, your pet's going to have a better time staying at home without a vaccine.
Yeah.
Absolutely.
So the
And
modified live one, by the way, is mostly used on like other animals, so not really on dogs.
Okay.
yeah, I've not heard of that in dogs.
Yeah.
Um,
And as well, because you know, in people, you can do a titer test for rabies. But the thing with animals is a lot of places you can't titer test with rabies. There's usually laws around having to give rabies vaccine in certain states or if you travel and stuff. So yeah.
And it's kind of
They
paradoxical
used to.
because we used to have to titer test. I mean, up till
Yeah.
I think it was 2012 or 2014 when the European pet passport was introduced, we used to always have to titer test. You had to vaccinate against rabies and then wait and then titer test before you got the passport. So it's certainly available and it's considered valid. It's just that legislation means that even though you know the dog is covered, you still have to vaccinate it because that's what the rules are about traveling with dogs. So it's even more frustrating if you titer test, because if you want to travel, you still have to vaccinate.
Yeah, because obviously Fusa's had this to come across from Thailand,
Mm.
and she was titer tested. I mean, the fact they can titer test for travel is one of the things I say to people when they're just looking for the DHPPI, like standard annual vaccine titer test, and they're saying, well, the vet says they don't do it. And I'm like, they will. If you're traveling, they will do it for rabies, so they know what it is. So yeah, definitely they are still doing that. I mean, obviously I had to have that done to get her back. In fact, it was when she came from Thailand that she originally had it. And then because we moved within the time period of the vaccine, because they're often triennial, aren't they, those ones?
Mm.
She didn't have to have it again to come back from Cyprus to the UK. But I think I did try and minimize. I mean, I did try to give her some detoxification support supplements. So I don't know, Vicky, whether there's any herbs you know of particularly. I mean, obviously with homeopathy, you've got the thuja. But are there any herbs?
I usually do just a homeopathic protocol around it, to be honest. If people want to do some kind of extra detox support for their pet, then you know that I can do that for them. But for most people, I do like a rabies nosode beforehand, and then I do thuja afterwards, and just have that as a standard protocol. And for people that have done that, I've not seen any issues. But obviously, that's a limited number of people because most people I'm telling to try and avoid the vaccine completely.
I have to say, I see a lot of issues. I always try to talk people out of it, but a lot of people travel and do it anyway. And I see a lot of dogs. It's just very, very clear their health falls apart completely when they have the rabies vaccine.
Even healthy dogs that you do a homeopathic protocol with?
Yeah, I see it often. Yeah.
Because I see lots of aggravation of existing disease, but the healthy dogs that have done it, I've not seen that many of having problems.
Well, I suppose, what's the hell? No, I do. I mean, I see it partly when I take a case history for the first time and I look back and see when did this all start, that it's so frequently started in connection with a rabies vaccine. But I also see patients that were treated for whatever was wrong with them with homeopathy, and they were completely cured and said goodbye. And then they come back 4 years later or whatever, and it's all come back because they thought, oh, that's all in the past. Now we'll go traveling. And then they had the rabies vaccine. And then it all came back.
Was that when you were doing a supportive protocol around the time of the vaccine as well?
Some of them for sure. Yeah, maybe not all of them, but I see it every week. Someone where I just have to try really hard not to say, well, I did tell you so. Because it's such a bummer if you've worked with an animal and they were so ill and they're cured, and you know, it's such an achievement, and then they have to be able to go to Sweden or whatever, and then they're just so sick afterwards, and it's like back to, you know, not even back to the starting point, but back to worse than it was when we started off treating them the last time. I just can't say it clearly enough. If there's any way to avoid traveling with your dog and therefore not to give them the rabies vaccine, that will be my very, very strong recommendation.
Yeah, I would also recommend looking up Canine Health Concern. if you can, that website, and getting hold of some of Catherine O'Driscoll's books and just having a read, because I think sometimes, I mean, people like the two lovely vets here talking about it, they will see this, you'll see this, and you'll see the vaccinosis issues. But until you really understand what can happen, I think those decisions are just being made, aren't they? And you're seeing that, Lise, you know, that they just think, well, I'll do it. And we don't really understand sort of what the side effects might be. So I would definitely recommend getting hold of Catherine O'Driscoll's books and having a read on that, because she was an expert and a researcher into vaccines for pets.
Or just take, you know, the fact that, you know, all of our homeopathy conferences, we frequently are hearing all the other homeopathic vets that are saying in the history, this all started within X amount of time of a vaccine, and more commonly than not, it is a rabies vaccine rather than one of the other vaccines. It just seems like the rabies vaccine is so much more of a problem for the animals' immune systems than the other ones.
Mm.
I would say it's the two killed vaccines. I mean, out of all the vaccines that are given to dogs, it's the rabies vaccine and the leptospirosis vaccine.
And
those are the one that cause the huge majority of issues.
We had a question about lepto, I'm sure, and then Vicky, you said you've been asked that a lot.
Yeah, Vicky mentioned one. Yeah.
Yeah. Should we go into that one then? Seems a good time.
Yeah, so lots of people in my clinic have been asking me about the Lepto2 vaccine, because that's being discontinued. So there's very limited, if any, Lepto2 vaccines still available. And a lot of, let's call them holistically minded people who have been trying to minimize vaccine protocols, might be doing titer testing or something like that for their distemper hepatitis parvo, but they've been worried about lepto, and so they have opted for Lepto2 over Lepto4 as the better vaccine, as in, you know, higher vaccine reaction rates to Lepto4 than Lepto2. But I think, like we've just covered, it actually, all lepto vaccines do seem to, with the rabies vaccines, have much higher vaccine reaction rates. And these reaction rates aren't necessarily what you're looking up on the data sheet, because what me and Lise are talking about aren't the kind of things that most vets are ever going to report as being a vaccine reaction issue. It's more a never well since vaccination problem, where the pet's health just gradually declines following the vaccine. So maybe they develop a skin disease, or their gut health declines, or they develop some kind of respiratory issue, or a multitude of different things. And it all comes down from that trigger. So I think that a lot of people that are wondering now what to do if they have been doing the Lepto2, if you're holistically minded and you're trying to minimize vaccinations, the obvious answer is to just avoid all lepto vaccinations now.
Yes.
You know, there's dogs that are vaccinated for lepto that are still getting lepto. Vaccinating your dog is not a guarantee that they are not going to get lepto. So if you've got these much higher vaccine reaction rates and you're trying to minimize that in your pet and give it a more holistic and natural and healthy lifestyle, then the obvious answer is to actually stop giving the lepto vaccine completely. And I talk a lot with different clients about the lepto nosode, so the homeopathic nosode. And, you know, there is data available in people to show that this can be hugely effective in lepto outbreaks. So there was this amazing study in Cuba where there was water contamination with lepto, and they rolled out the lepto nosode and they had amazing results. So, you know, there's a minimal data for a lot of the other homeopathic nosodes, but actually for the lepto nosode, there is some valid scientific studies which you can easily find and read to find out more info about that. So if that's kind of what people are wondering about what to do now, that would generally be my advice. I don't know what you think, Lise.
No, I completely agree. I mean, there are particularly there's some Facebook groups about some really quite large Facebook groups about the damage caused by leptospirosis vaccine, and some horrible stories in there, and you know, it's heartbreaking. But I see the discussion going on there now is about this fear that we're losing the lepto2. What are we going to do? And I just don't understand. I just don't share that concern, really. It's possible that the Lepto4 vaccine causes more problems than the Lepto2 vaccine, but the Lepto2 vaccine certainly causes enough problems for me to advise against it. So in a way, maybe this just makes it easier to say no to the leptospirosis vaccines altogether. I don't think it's an issue that we must have Lepto2 rather than Lepto4. I think the question in each case is largely depending on where the dog lives. You know, is it really worth the risk considering a leptospirosis vaccine for this dog? And certainly where I live, the answer in all cases, that I can't think of any exceptions, would be no. I would never dare to give that vaccine to my own dog, and that includes the Lepto2. So it's not something that I worry about at all.
I think for those who didn't know, the difference between the Lepto2 and the Lepto4 vaccine is that in the Lepto2 vaccine, you have 2 strains of the bacteria, and the Lepto4, you have 4 of the most common ones. And yeah, so they've seen more side effects of the 4, but I think we've seen them from both. And it's a bacterial vaccine, which means that you have to do it every year, which is a lot of exposure to vaccines. Was one more thing that I was going to say. Oh yeah, and obviously since leptospirosis is a bacteria that is usually found in areas with a lot of rats and is often taken up by urine or drinking puddle water. So I think if you want to avoid doing the vaccine, obviously then you should try to limit your dog's exposure to maybe areas with a lot of rats. If you have leptospirosis in the area, maybe stop them from drinking puddle water, like doing more preventative things like that, making sure they don't catch it in the first place.
But it also depends where you live, because it is really a tropical disease. I mean,
don't you think it's tough to do? I mean, you're right, Lise. It is a tropical disease, and it proliferates in heat. So
exactly, yeah. So if you're in Latin America, sure, but I mean, in Northern Europe, I wouldn't even worry about it. It's so rare.
And I also think like lepto. So lepto, for anyone that doesn't know, is the same as Weil's disease in people, and like it's been around for forever. You know, lepto's always been about. So I'm sure there have always been some animals that occasionally might pick up lepto and die. But, you know, it's not something that is such a massive issue. I think sometimes it can become ramped up because obviously if it becomes a popular thing that people are always asking about, the more you test for it, the more you find it. It's the same with so many of these things, like, you know, going back to COVID times, like the more they tested it, the more they found it, and suddenly everybody had it, even people that didn't even have any disease. Suddenly everyone had COVID. Oh my God, it was awful. So, you know, the more you test for something, the more you're going to find it. And, you know, are these animals actually dying of lepto, or is it something else? Did they just happen to have a positive test for that? And I think a lot of the time we don't know. And sometimes, you know, clients are saying, oh, it was assumed it was lepto because they had acute liver failure or acute kidney failure. But there's loads of things that can cause that. You have absolutely no idea if you don't do detailed testing whether it actually was that. So I think that actually a lot of the lepto levels, disease levels, are quite inaccurate, some of the data that's available.
Yeah, and the data still says that it is an incredibly rare disease, and I absolutely agree. I totally don't believe some of the things that get given that label, that you know, you've got to call it something. Absolutely. I think the thing to keep in mind is that a vaccine is supposed to be a solution to a problem. So you need to have the problem, you know, to justify the vaccine. There needs to be a problem in the first place. I have never seen a dog with lepto in my life. I've tested for it a few times. It's always been negative. I've not had a lepto patient, so it's really not something I can worry about, even if I try. Before my time, distemper was an issue, and it was solved through vaccination. I certainly remember parvo being an issue, and it still is in some places, and sometimes it flares up. So I think those vaccines are relevant and important because they are a solution to a real problem. I don't see that about lepto at all. Lots of people are worried about lepto. They've never, you know, why? The vaccine came before the worry. The vaccine came before the problems, and then we need the problem to sell the vaccine. I just don't see it as solving any known problem that I've ever been aware of.
And actually, we know that a bigger problem that is killing pets is things like cancer, and severe autoimmune disease. And we also know that vaccines can be involved in issues with the immune system that can lead to immune-mediated disease and cancer. So actually, the problem that we've got would be better resolved by minimizing and reducing vaccination, because that would actually help more of the pet population.
That's such a good point, because immune-mediated disease is a huge problem. Leptospirosis is a tiny problem, almost a pretend problem. So that it just doesn't add up. And obviously, in each individual case, the question you have to ask is this disease that I want to vaccinate against, is it a threat? Is the threat that it poses to this dog big enough that it justifies the burden to the immune system that will happen if I give the vaccine? And for most dogs, certainly in Northern Europe and lepto vaccine, absolutely not. No.
I think that's where it gets sort of thought about with guardians, though, because you do have the veterinary industry publishing experts in the media about leptos around in your area, and then obviously the panic begins. So, you know, it's like the problem is created in the media, at least. So sure. I think it can be tough for people to think that they're avoiding areas where there's rats as well. So the fears do come in, but knowing that the Cuban study with the nosodes went so well, I mean, perhaps that is the way forward for people if they do have the fear or the concern to contact their homeopathic vet.
Yeah, and I mean, it's such an easy thing to do, and you know, I always try and at least have some kind of like phone consult with people so that they understand the principle behind nosodes, because it's not like you can just swap your yearly vaccination for a yearly dose of a nosode. That isn't how it works. You need to have an understanding of how nosodes work so that you can make sure that you're dosing them appropriately and things like that. But, you know, I can cover that in like a 10-minute phone consult for somebody if they just want a brief overview of like how nosodes work. And that's very easy to do. And then that can be them set with nosodes for life. If they just want repeat prescriptions, it's very easy to order those.
Fantastic. That's really good news.
Can I just, one last thing on this topic is that I think it's important to add that this is not because we're holistically minded or because we're homeopaths or because we're, you know, this is well established that vaccines cause problems, and that the WSAVA report has, or at least the previous version, had a table of side effects from vaccination with some very serious illness in it. And there has been studies published demonstrating very clearly that vaccines have the potential to cause very serious side effects, that these side effects happen more frequently in young dogs, in small dogs, when multiple vaccines are combined. And I think the risk of the owner coming back to the vet to complain about an adverse reaction following a vaccination was 7 times higher if lepto had been involved in that vaccine. So it's well documented. It's not something that we, you know, have some sort of holistic alternative viewpoint about. This is well documented. There are adverse effects, and there is a risk of adverse effects when you vaccinate. So you always have to weigh up, is the benefit of this vaccine so great that it justifies the risk? And in terms of leptospirosis, I haven't seen it. If I was practicing in Latin America or in a tropical climate, I might feel differently about it.
Yeah, I think the weird thing here is, you know, it even says on every website, everyone who makes a vaccine writes this, you know, vaccines are to be given to healthy animals. And even when I was a new graduate, you know, I would kind of just like do what I was told. I would stand in the consult room, and then I would get a pet with cancer in for a vaccine. And I would be like, I'm sorry, like, there's priorities here. Like, this cat is not even outdoors. I think a lot of, I think sometimes this point is missed, and I think sometimes people have to advocate for themselves. Like, is this vaccine really,
sometimes
is it really worth it?
I think it's awful. I see it all the time in histories where the vet will have written in the history, you know, like ear infection, and they've dispensed antibiotic and steroid ear drops for the ears at the same time as giving a vaccine. And I'm thinking, so the animal has an active infection, which you've given medication for, and you're also vaccinating them at the same time. And, you know, all the time you see this.
This would never happen to a human.
No.
It wouldn't.
It's crazy.
No, that's a really good point to include. You see chronically ill animals. You see animals on daily medications to you know,
Hope.
because their immune systems are so destroyed, and still you go in and give them vaccine cocktails. It's crazy. And you know, only vaccinate healthy animals is a very important point. And and if you must vaccinate against several diseases, try to separate them as much as you can rather than give one big cocktail. Yeah, good point.
I see this a lot, as you can imagine, with the histories that I'm told. When they get to the point that, you know, they've thought about diet, usually at that point they have been vaccinated as a poorly animal, and I too thought that that was the case. And I do say to them, you know, question any annual vaccines, because, you know, an itchy skin dog or a gut health dog or a yeasty dog is not a healthy dog, really. And it might seem like a smaller condition than, say, the cancer, but it's still a condition that isn't healthy. So, you know, it's but at what point is a vet in any way breaking any code of conduct or WSAVA conduct, or by doing that, or are they just breaking the contraindication sheet of the vaccine? I mean, at what point is there any liability there?
I mean, I guess it comes down to whether anyone complains about something happening afterwards. And I think, you know, vets are so good now, unfortunately, at saying that, oh, no, it definitely wasn't the vaccine. It was nothing to do with that. And, you know, they assume that if nothing happened within a few days after the vaccine, it was nothing to do with the vaccine. And that's just completely false. That's not how the immune system works. Yeah. It would be like doing a scientific study that you rolled out amongst all people, where they gave people a vaccine and they only looked at them for 3 days after the vaccine, and they ignored anything else that happened afterwards. And they said, no, they were fine for 3 days, therefore the vaccine is safe. I mean, that would be completely laughed at in the scientific world, even amongst the vets. If a study only studied animals for 3 days on a medication, no one would be giving that. They wouldn't assume it was safe. It just seems completely wild to me that this is just what vets think, is that if it didn't happen in the few days following vaccines, it wasn't to do with the vaccine.
And actually, the WSAVA report on vaccines, I think it's the 2013 version, spends pages on this, talking about how vaccines can have side effects and how they are grossly underreported. And their wording is that vets, I mean, they say that vets don't see it unless you have an acute anaphylactic reaction on the day of the vaccine. In most situations, vets and owners miss it as a vaccine reaction. And they write that the adverse reaction that was directly caused by a vaccine can occur days, weeks, months, or years after the vaccine that caused it, and it is missed. And yet I've heard colleagues, very experienced vets, say, I've never seen a vaccine reaction. Yeah. And if they say that, what they're saying, first of all, is I have never read the WSAVA vaccine report, and I don't follow this topic. I don't follow, you know, I mean, there are so many papers published about vaccine reactions. So fair enough to say it was my professional assessment that this dog would benefit, you know, looking at the pros and cons, this dog in this situation benefits from this vaccine. That's maybe a fair assessment. But to say I've never seen a vaccine reaction, vaccines can't do harm, that's just not a person you can take seriously, because there's so much published evidence to the contrary.
Should we get out to the next question?
Yes.
Otherwise, we can talk about vaccines.
Let's leave vaccines. Yeah,
yeah.
It's a sore one.
Session just talking about vaccines. We did have an interesting question here. Someone asked, what is the best vet, the holistic vets versus conventional vets? And if you don't mind me starting this off, I definitely think for an owner looking at this, should I get a holistic vet or should I get, you know, a regular vet? I think it's important to know that I think sometimes holistic practices don't always have all the things that they do have in other conventional practices. So in here, my opinion might be, you might want to have both. You might want to have a conventional practitioner and someone that can help you during emergencies, and if they need surgeries, and if they need anything, you know, if they're really, really acutely ill, especially. And then I would recommend to anyone that has a pet to have integrative or holistic vet on the side that can help you with the difficult decisions, someone that you can discuss things with, and then they can kind of discuss what to do going forward, because not all holistic vets, maybe if you have them online or so, they don't necessarily do, you know, surgeries, and they can't always prescribe things, or even if you're in a holistic practice, maybe there are certain things they don't do. So I think, yeah, my opinion is important to have both. I don't know, one is better than the other, but definitely you want to have a contact with both. I don't know about you, Lisa.
No, I couldn't agree more. I mean, I think that's exactly it. And I think that that they are not in conflict. You know, it's not a choice between one or the other. It's different toolkits and it's different skill sets. And there are situations where you're going to need one, and there are situations where you're going to need the other. And I have a feeling, because I get this a lot, people say, oh, but there's no holistic vet, and you know, I don't have a holistic vet in my village or whatever. And I think, well, sure. And I think sometimes, I don't mean this rudely, but I think sometimes maybe when people say that, what they mean by a holistic vet is someone nice and not too invasive, and I'm not quite sure what's meant by that term. But I mean, a holistic vet to me is a vet who, after their conventional qualifications, has spent 3 or 4 years learning and a different skill sets on top of that, so that they are qualified in osteopathy or acupuncture or homeopathy or whatever. And that's a lifelong learning path, you know. And most people who do that, most vets or doctors that I know who do that, end up leaving general practice because they want to be focusing on getting better and better at their chosen holistic modality. So the idea that you have someone who is really, really good at everything, I think is not realistic. I mean, I haven't done any surgery in 20 years. I wouldn't want me to operate if someone needed surgery or you know, whatever might need to be done acutely. No one can be an expert at everything. So I would wish for most people to have a competent, you know, really competent conventional vet in their local area that they build a rapport with, who knows them, who's open to discussing how we're going to approach things, but who have conventional skills and who follow the conventional field. I mean, it's a full-time job to keep up with developments in conventional medicine as well. And then if there are specific issues that need different tools, then go and see a holistic vet for that problem. If your vet develops arthritis or whatever, go and see a chiropractor or an acupuncturist. If your vet has, if your doc has allergies or whatever, go and see a homeopath. But see the people who can help you in that situation. But nobody can keep up with conventional medicine and be really skilled and experienced in acupuncture and homeopathy and all the other fields that there are. It takes a lifetime to be great at each one of them. So it's exactly what you were just saying. You need different people for different jobs.
I think from the Guardian's point of view, they know nothing. They get a dog and they decide they're going to fresh feed. They go into their local shop. This is just a scenario that I know has happened. And the shop will say, well, really, you need to be working with a holistic vet because they're more likely to appreciate the fact that you're raw feeding. So they go and they Google a holistic vet. Now, there is no holistic vet website that lists all these lovely holistic vets. So what you'll find is that they're listed under their modalities because they're not, as Lise was saying, they're not generally in conventional practice. So you might have, in the UK, we've got a few really good integrative practices where holistic vets work alongside conventional vets, one of which is Towerwood, which is up in Leeds. And many people do make the trip to go to these because there's so few of them. I think there's a great one down Southampton way that does a lot of TCM type medicine, but you're not going to be able to register your dog with a holistic vet. You're going to register your dog with a conventional practice, and then you are going to be empowered, hopefully enough, to feel confident to ask for a referral to a certain holistic vet, such as Vicky that's with us now in the UK. And you might even have to specifically know the modality you want to work with. So especially in the UK, it's very similar to if I had an ailment of some kind And I would think, well, do I want to go to my doctor where I'm registered, or do I actually want to go and find an acupuncturist, or do I want to go and find a Bowen therapist? So I actively then choose which modality, and I will look up Bowen therapists in my area. So you'll find if you look up the herbal vet in your area, the homeopathic vet in your area, the acupuncture vet in your area, you will find vets who, as Lise was saying, have done the conventional training, have then specialized in a certain modality. They'll be listed on the modality websites. So you'll notice on Vicky's account now, it says BAVH account and not account. So Vicky, do you want to tell us a little bit more about how people might find a herbal vet or a homeopathic vet?
Yeah, so I'm on the Herbal Vets account because I host a webinar for them. So for the finding a herbal vet, you go onto the British Association of Veterinary Herbalists website, which is www.herbalvets.org.uk, and I'm sure we can put the links below the talk at the end. And for the homeopathic vets, it's the British Association of Homeopathic Veterinary Surgeons. So it's bahvs.net. And both those websites have a find a vet section. So you can, on the herbal vets, it's just a list and you choose your area within the UK. And then you can find the vets with their addresses in that particular area of the UK. And for the homeopaths, it's just a map. So you can literally see points on the map where the homeopathic vets are. And all the contact details and everything you need to find them are exactly there. And yeah, I just agree with what everybody said. You need both. I do have some people that do register with me, and they register with me for annual health checks because they still want to. They're not vaccinating, so they're not having that reason to go to their vet every year, but they still want to have their pet checked over every year. And I think that's really important because a vet will pick up on stuff if they're doing a health check. And some people do register to come for that. But if their pet develops a condition, they will quite often have to go to their normal vet first, have tests done or x-rays or whatever it is. We need a diagnosis. We need to know what's going on. And then their vet will have to refer back to me. Even if they're registered, if it's a complex condition, I will always still get that referral back or at least request the history and all of the test results, because otherwise I'm working blind. I can't do anything without working alongside that conventional vet. They have all of those facilities that I don't offer anymore. And I don't register anybody that doesn't have themselves registered with a normal vet.
Can I add two things? First of all, what Caroline said, I think is spot on. It's very similar to the situation with people. I mean, we have a conventional GP, and what we want from them is for them to be competent in their conventional medicine and their diagnostic skills, and we want them to be people that we can speak to, okay to talk to. And then if there's a specific problem, you may go and see a holistic practitioner. So it's very similar to the situation in human medicine. And the other thing, I just want to take the opportunity to mention my book, because at the back of my book, there are 2 pages which lists globally all the different organizations, including the ones Vicky just mentioned, where the holistic veterinary organizations in America, in Australia, in the UK, in as many countries that I could possibly find them, listing vets that do acupuncture, osteopathy, chiropractics, homeopathy, herbal medicine, etc., etc. So that's one place to find them. And there is also a chapter in my book called Who's Your Vet, which talks exactly about this and about the fact that you need a good conventional vet, and what is a good conventional vet, and how might you find them, and what trick questions might you ask them to see whether they're going to be the vet for you, like how do you feel about raw feeding, do you do titer testing, etc., etc., to help you find a vet that you can talk to. But what you really need is a good conventional vet down the road that is open to communicating with you in a open and equal manner.
I just think open-minded, 100%. Like, as long as they're open-minded and willing to discuss things with you, to answer your questions and not just placate you with some, wishy-washy answer or some overly scientific jargon. You want to be able to actually have a conversation with them. And if you say, could you refer me to a holistic vet, you want them to be happy to do that. Even if they disagree with that modality, or, they don't believe in homeopathy or whatever it might be, if that's what you want to do, it's your choice as a pet guardian to make. And therefore they should just be open-minded enough to be happy to do that.
Yeah.
And I also wanted to add something just about acupuncture when we're talking about where to find a practitioner, because I've also seen some courses out there that are not as fulfilling as others. Some of the courses kind of just throws you a book and tell you didn't, just learn this and that's kind of it. And some courses are very extensive. You have on-site online learning, you have exams, you have to write case reports and so on. So at least I could recommend anyone from Chi University, Florida. They have practitioners all over the world. If you go online, you can go on the Chi Institute's website and find a practitioner, and they have a map looking for certified practitioners that are certified by them. So yeah, also important to look at the quality of what you're paying for.
Yeah, sure. And also IVAS.
That's true, because in the UK we have a lot of vet acupuncturists that only deal with pain. They're not TCM trained at all. They wouldn't know why it works, especially not the energy side anyway.
And actually the majority, I would say, because the majority of courses available in the UK for vets for acupuncture are just Western acupuncture.
They're Western acupuncture.
That's all the training I've done. I haven't done TCM acupuncture training because I've been learning homeopathy and herbs as well, and it was too much for me to delve into TCM as well. You have to, like Lise said, you can't be an expert in everything. You have to choose some things and end up sticking to them. So sometimes I'll have people ask me about using acupuncture for something, and I'll say, that's just not something that I'm experienced in. If you want to treat your pet for that condition with acupuncture, you might want to find somebody else. But if you're happy for me to treat them with homeopathy and herbs, that's what I would first reach for to treat this condition. And then we can do that. And if we don't have success or whatever, then absolutely you can find somebody that's happy to treat that with acupuncture. But as a vet, you also have to know what you're good at and what you're not good at, and be able I'm willing to share that with people.
And maybe one final comment when we're talking about choosing your vet, because I do think it is important to have a vet, to have a local vet, to find that person that you would go to if you suddenly had an emergency. And one other criteria that I would look for is an independent practice, if possible, rather than someone who is part of a big chain.
Yes.
And that's getting harder and harder, but it's
It's a very good point. The corporates are buying all the practices now, and the turnover number by veterinarians in this practice is just flying. Like people are in and out, nobody wants to stay there, and it's hard to get a good relationship with that one person that you want to.
And that's exactly the important pin, which is also why it's a good idea when you book an appointment, ask for a vet, ask for a named vet. Don't just book an appointment if it's a big practice. Try to get to know one vet and try to book an appointment with them when you call the practice.
But that said, with the corporate practices, if you've got a vet in a corporate practice that you're really happy with, we're not telling you to find a different vet.
No.
Because there are some amazing vets that work in corporate practices. But if you're looking for a new vet, then maybe it would be better to look in an independent practice.
Absolutely.
I don't know if I have a lot of short questions. I definitely had one today about acupuncture that I can do quickly. It was Sally, who was just started acupuncture on her dog and had pain on the back when one of the needles were put and yelped a little bit. So she wondered, does the dog get put off by acupuncture if they had pain on the first visit? They shouldn't be. I mean, every individual is different. I think generally I find in my practice when I do acupuncture is that every time they get a little bit more calm, and most of them really don't mind the needles at all, depending on the individual, what you're treating for. When it comes to like finding your point in acupuncture, obviously, if you find an area that's very painful, you often want to avoid putting needles in that area because you don't want it to be uncomfortable for the animal. So you might pick like other points that can kind of open up the channel between, and you can put distant points for pain. And there's a lot of points to choose from. So obviously then the practitioner will know for next time, this area is very sore. Maybe we'll treat, other distant spots the next time, and then try to avoid the ones that they don't like. But I think overall, I find actually I really enjoy my acupuncture appointments. It's really quiet. We listen to very quiet music and we're talking, and the animal is relaxed, and lots of cuddles, lots of treats. I think it's one of my favorite type of appointments, and it seemed to be for my animals as well, because most of the animals are happy to come in, which is not always the case as a vet with your needles.
Yeah, exactly. And I would add that I think it's almost the opposite in terms of that question, that they may be quite tense the first time they come in, but they quite quickly learn that actually this is nice, and that they feel better and that it's a nice experience. So it tends to get easier and easier.
Yeah.
Yeah.
I totally agree. And I would think particularly in backs, if that's what she was talking about,
Yeah.
there can be so much tension in the back. And you
Yeah.
can put in, you know, I saw a dog today that I saw a few weeks ago and, you know, she came in and she was like, she could barely sit down. She looked so awkward. And we did just, you know, like 3 pairs of needles along the back. And, you know, there was a lot of muscle spasm at the entrance of each needle because there was so much tension in the back that it could have looked like that was so painful. But I think the dog was so painful anyway that actually the muscle like spasm was not necessarily a pain response. It was just the muscle reacting to something happening to it. But then to see that tension just like disappear while those needles sit in, and to see the shape of the dog completely change over the course of, you know, 15 minutes is just incredible. And I think even if those needles going in might have been a bit uncomfortable for them, the change they must experience, they must realize that that relates to what you've done, because you know, sometimes they thank you for it. Like this dog turned around and like gave me a little lick on the nose.
Yeah.
So cute.
Should we do one quick more question?
Can I just ask, actually, I know we've only got a few minutes, but it does interest me about this. So one question is, do you use exactly the same needles with pets, or are they smaller, thinner, shorter, whatever, or do they not go in as deeply? Because my personal experience with acupuncture is that I had to find an acupuncturist that it didn't hurt with, and that took me 3. I'm with one now. Whereas this acupuncturist can put the needle in the same place in my wrist and it won't hurt. Whereas the other two, I almost wanted to take that out. And I could imagine if I was a dog, I'd be like looking to nibble it, or I'd be just trying to move it, you know. And the other two used to say, sit with it, you know. But now I'm with one that will, as I said, it doesn't hurt. So, you know, is this the case with dogs? I mean, it's the same needles.
So yeah, the thing is actually there's a lot of different sizes of needles. There is super short, there is longer, there is even longer, and there's very long. And for horses, we have massive ones, and there's also different thickness. And you might notice if you try different thickness, especially of needles, that the thinner ones, you can almost barely feel them. Thicker ones, so you can definitely feel them. So then it depends a little bit on what response you're looking for, the personality and constitution of the animal, and how much of a response you really want with it. I see some people use very, very thin needles that barely feel it. Especially if I have a very like earthy type, they're chill with everything, they need a bit of stimulation, I would pick like a thicker needle. So for me, it depends a lot on the animal, really. But yeah, the thinner ones you generally feel less. And sometimes if you put them a little bit, obviously you put them in nerve endings, so it is a sensitive spot, but if you miss a little bit sometimes, well, it can hurt a bit more. So yeah, a lot of factors going into it.
But also sometimes you put a needle in and the dog is, you know, immediately they're like, no, absolutely not. And
you
just take the needle out again, or the dog has already taken it out and you go, right, well, that's obviously not the point that we're going to do today. Because you're listening, it's like a two-way street. It's not just stabbing it with a load of needles. You know, you're listening and watching their response, and you're using that to help you decide what you do next. And if that point was a big no-no, then you know that you just leave it.
Yeah, I'm just imagining with people, you know, you just like, you put the needles that you want to take and you say, lay down, lay still, and you just leave them. You know, with animals, not like that at all. You know, you like, I want to do these 5, but then you end up doing maybe one of them and then doing 4 other ones because the animal's just like, no, don't touch me there. It's like, okay, we need to find another point then that does kind of similar effect. You know, it's some points are difficult, some points are far away or on the inside, and yeah, it depends a lot. I think we don't have time for another question, really, do we?
Gosh, that was an hour. Yeah.
A very short one. No, we've only got a minute now. Sorry, guys.
Yeah, we've got a minute left. Someone was asking about cats. Can I make a promise? Because someone was asking about cats and neutering cats, and there were some points I wanted to cover about that, and I promised that I will do that in at a later time.
Shoot.
Okay, so next week we will be back. Who's our guest, Tina?
Oh,
that's Beatrice, isn't it?
I think. Yeah.
Yes, we have a brilliant German vet, Beatrice is going to be with us next week. Yeah, it's going to be amazing as well.
Wonderful. Okay,
And
and we will get to more of the questions. Tina's got a long list, so we are getting through the questions. We will. Thank you so much for watching, and thanks to Vicky for joining us.
Yes.
Well,
no worries. It was a joy.
Come back soon.
And our little sister at the very beginning, our very little sister Willow.
Yeah.
Okay. Bye everyone. Bye. Thanks.
Bye.